So this is part 3 of a 4-part series discussing our patient with high cholesterol, elevated LDL numbers that's been trending up for the past 3 years, but is not ready to take a statin medication at this time. So quick recap, if you've been following or have not been following along, this is a 47-year-old busy mom who comes in for a new patient visit. Her LDL has been trending up the past 3 years from 140 to 160 in the 180s. She has high blood pressure, prediabetes, not sleeping very well, and strong family history of heart disease, and going through the menopause transition. For the past 3 years, she's refused to take statin therapy because she really wanted to focus on lifestyle changes to manage her cholesterol. And now she wants to discuss what her options are medication-wise. Before we even got to that, we did review her actual cardiovascular risk in terms of getting more history and also looking at not just heart disease, but possible sleep apnea, and as well as the menopause transition, how that can affect her cardiovascular health as well. Now, what this video is really going to focus on is going to be her blood work. So what kind of labs does she need? She's had a lipid panel in the past. Every year she's had it for the past 3 years. But she's not had any other blood work outside of lipid panel, CBC, and CMP. So what does she need now? We will still do a CBC to look at anemia or anything else that could be contributing to her fatigue. We need to do a metabolic panel, look at liver function, kidney function, electrolytes. Kidney disease, unfortunately, does worsen cardiovascular risk, so that's important to know. We'll also look at her TSH and free T4. Hypothyroidism does increase cholesterol levels. And then when we get to her cardiac labs, we have a lipid panel, so now we're going to look at her ApoB, her lipoprotein A, high-sensitive CRP. She's had an A1C, but I also like to do a fasting insulin as well with these patients. Her ApoB will be a great number to tell us her atherogenic particles, which is most of the time better assessment than the LDL alone. And then lipoprotein being a genetic marker will also help us in terms of risk stratification. And of course, high-sensitive CRP is a marker of inflammation, so we can really see her cardiovascular risk in that sense as well. For our patient, we did get a calcium score, which I spoke about in my last video, and her calcium score was not 0. So that also has to be part of her conversation in how aggressive do we have to be in treating her. Now, she wants to talk about medication options, but she does not want to talk about a statin at this time. Her question is, what other things do I have? And do I have other options outside of statin therapy? And we'll talk about that in our next video.